Welcome to a St. Francis exclusive. My name is Brian Pavlick. I am a marketing manager for the medical partner group that is the primary and specialty care network at St. Francis. And I'm joined by a wonderful colleague. This is Hannah Bernstein. She is with St. Francis Medical Partners OB/GYN group. Hannah, good morning. How are you?
Good morning. I'm doing well. Thanks for having me.
Absolutely. You're new to us, and we're going to get into who you are and where you've come from and what you do in particular with some great advice for ladies as we talk women's health today. And as we start, OB/GYN care, it's something that will never go away. And we'll talk a little bit about how it may have changed during the pandemic and such, and of course, get Hannah's expertise as we will learn here shortly. But Hannah, before we get into some specific things about women's health and OB/GYN services, we want to know a little bit about you because you're joining a great group with Dr. Clayton right there in Memphis. And we just want to learn who you are, where you've been, and what you kind of specialize in. So I'll let you take it for a few moments here and just kind of promote and brag on yourself.
All right. Well, I was born and raised right here in Memphis. I've been here my whole life. I have an amazing husband. I have a 1-year-old daughter, and we have a crazy golden retriever. So I'm very busy outside of the office. I went to the University of Arkansas in Fayetteville, the Razorbacks, for my undergrad. And then I was a nurse for 5 years before I went back for my master's degree at the University of Alabama, Birmingham. And I worked in the NICU as well as labor and delivery. And I started working here in September. And I've learned a lot so far, and I've really enjoyed meeting all of my new patients. And I love seeing annual exams because I really have more time to get to know my patients, get to know what their goals are, what their problems are, and get to follow up with them in the future. And I love seeing our OB patients, our pregnant patients, because I see them so frequently throughout their pregnancies, and I get to offer support and education along the way and see them right through the end and postpartum period as well.
That's cool. So real quick, a side note. So I'm not going to ask you here, but have you called the hogs in your life before?
Many times.
Okay, we're not going to ask you to do it here. If you want to see
Thank you.
all the hogs when you're in the office, just ask her, and I'm sure she'll tell you what it means.
Yes.
So there you go. Go Razorbacks. All right.
Yes.
Let's go ahead and start. It's now 2023. And again, I'm going to ask you the COVID question here in a little bit, but let's just pretend the world is back to normal because people are saying, oh, everything's back and all that. In general, why is this now a good time to start seeing an OB/GYN provider in 2023?
Well, I think it's always a good time to see an OB/GYN provider, no matter your age. We see women throughout the lifespan. I see patients as young as 15, all the way through menopause and way past menopause. So we're here to be of assistance to you throughout the lifespan. We're here to listen and assess your needs and come up with a plan of care together that works best for you. And I think, the first of the year is always a good time to set new goals. And I think, starting your healthcare journey is a great goal to make, and it's an investment in your own health and your future.
So establish with that primary care. In my case, go for that sleep apnea test. I mean, just all kinds of goals that we all have. Yeah. But women's care is a part of that. And now we'll talk about it. The past 2.5 years, you're going to school and all that, and the world is going crazy because of COVID and all this. Just what have you seen? And I know, again, we're not talking about years and years and years of experience. We're just talking about what you've seen in 2.5 years, student coming into the work field now for St. Francis OB/GYN. How has OB/GYN care changed in the last 2.5 years? Is it getting better? Is it getting back to normal? How would you just kind of take a 50,000-foot view and say, in the last 2.5 years, here's what we've been able to do with OB/GYN care?
Right. Well, the COVID pandemic and its effect on healthcare was certainly unprecedented. Right. I will say in OB/GYN, it wasn't as affected as other fields because our patients still needed to be seen, especially our pregnant patients. Some of our elective procedures had to be postponed until the risk was lower. But throughout the pandemic, we continued to see patients and offer them the same high quality care, just with more rigorous safety protocols. But we're definitely like up and running, and I'm accepting new patients. And if you put off some of your health screenings during the pandemic, now is a great time to come and see me. We have a great team here, and we'd love to get you caught up.
Absolutely. So Hannah Bernstein, she's with our St. Francis Medical Partners OB/GYN group, joining Dr. Patrick Clayton and the wonderful team there. We're just talking about just who she is, where she's come, but now we're going to get into the expertise part, because we're going to show you she knows what she's talking about. And Hannah, you mentioned you've seen them as young as 15. I've got a daughter turning 14. I can't believe I'm getting this old and she's getting this old, but those young teenage years, tell me just a little bit about what conversations are they even having? Because their mom or somebody may be watching this and they may say, is it time? Is it too early? So is it too early? And if not, it's a perfect time to start. What are just some initial conversations you're having with them?
Yeah, it's certainly not too early. If a young teenager is having problems such as painful menstrual cycles, heavy periods, that's not normal, and that's something that we can definitely address with them. I know that the OB/GYN clinic can be kind of an intimidating place, especially for young folks and people that have never been before. But at that young age, we don't have to do a pelvic exam. We would love to just sit down with you, listen to you, make you feel very comfortable.
Well, that's awesome, Hannah. So I'm turning 40 in May, and I won't tell my wife's age, but let's just say all the ladies that I'm graduating high school with are now turning 40. And I know this opens up a whole new world of screenings and annual wellness. And of course, now you may be dealing with the majority of women who have either experienced pregnancy or are trying to get pregnant. There's a variety of different things going on when somebody turns 40. So what are those questions and topics that you might be having with people at that age at this time in their life?
Yes, we definitely encourage everyone to come in for an annual exam, which will include a breast exam and a pelvic exam. We'll make sure that she is following up with regular pap smears, mammograms, colonoscopies. If you are at home and you're experiencing heavy periods or painful periods, pelvic pain, chronic pelvic pain, pain with intercourse, none of that is normal. And please come and see us because those are all issues that we can address with you. It is February. It is now Heart Month, which is very important to us in OB/GYN because heart disease is the #1 killer of women. And it's very important to start minimizing your risk for cardiovascular disease early, especially if you can start, mitigating that risk as early as possible. When you come see us for your annual exams, we can help you identify your risk factors. We can provide education. We can get annual blood work, including your lipid levels. We can follow your blood pressures. If you are at high risk for cardiovascular disease, or if you have high blood pressure, if your lipids are high, I would encourage you to see primary care. And we have a ton of amazing primary care physicians in our network that we can refer you to. But if you're here for an annual exam, that's definitely something that we're going to be following in the age 40 age range.
There you go. So not only is she the expert in the care, different levels, she plugged the company. Good job, Hannah. You're going to go far here in the thing. All right, I got one more age group for you. Now, I love our lovely senior adults, and sometimes they're more frequent flyers due to a variety of health issues or the fact that they just like to get out and use it as a chance to catch up and talk. What type of relationship do you have with these geriatric patients, and what do they need to do as they continue their women's health care?
We love our older adults here. I love seeing them. We can most likely stop pap smears at the age of 65 if you've had enough normal results in the past, but we still recommend that you come in once a year. We'd love to catch up with you and figure out what's going on. We'll make sure that you're getting your bone density scans, which typically start at age 65. If you have certain risk factors, we'll ask you to start a little earlier. But we will definitely be screening for osteoporosis in this age group. If you're having any issues with burning with urination or frequency or incontinence of urine, or if you're ever bleeding after menopause, that's not normal and we would want to see you.
Gotcha. All right.
Mm-hmm.
Hannah Bernstein, she's a new face, but she knows what she's talking about. Go out to St. Francis Medical Partners OB/GYN. That's that group over there with Dr. Clayton and his staff. And you'll see a new face, and you'll feel like she's been there a while just with her expertise. And Hannah, we can't wait to see you and how you just influence so many lives in Memphis. And you're off to a great start already. But we just appreciate you taking a little bit of time today just to tell us about yourself and also tell us about women's services. And ladies, if you're watching this the day we put this video out or down the road and you stumble across it, go out and get some OB/GYN care. We've got some wonderful providers within women's health all throughout St. Francis Medical Partners and through the St. Francis Network. And then, as she mentioned, there's primary care, there's cardiologists, there's all kinds of people that are going to be partnering together for your personal health journey. So your health can't wait, and it's always done when it's better together. So Hannah, I appreciate your time today. For everybody else who was watching, thank you very much, and we will see you soon.